Good afternoon, everyone. Good afternoon, and welcome to the lunch panel. Just a couple housekeeping items before we get started here. I wanted to mention the card that I keep bringing up. Just make sure you stop by the advocacy table and fill out the card. And thank you, Amy, for bending it for me because it tears off this way and it's easy to drop off your information to us and learn about our amazing initiatives that are going on for early childhood. And it will connect you to everything going forward in the next few months. The other thing I wanted to mention is if you want to watch the morning speaker or our panel, you can go to grps.tv and they have a YouTube channel where you can catch whatever you missed, or if you want to encourage others to watch what has transpired today in such an amazing way. So I just want to thank you all for coming out and thank staff, our dream team, our steering committee, everyone who has really participated in this amazing day for early childhood. Ready by 5. Is everyone ready? Yeah. So at this time, just prior to our panel, I want to bring out someone who is really special to this effort. She came in from Washington, D.C. Nancy Lim is a program manager for the National League of Cities, and she's here to take you through some details of the amazing work and partnership that we do with National League of Cities. Nancy.
Thank you, Annemarie, and thank you all. It's so great to be here with all of you today. It's been a wonderful morning. I'm Nancy Lim, and just for those of you who are not familiar with the National League of Cities, we're about 100 years old. We're the nation's oldest and largest national organization representing the more than 19,000 cities, towns, and villages throughout our nation. We do this through our advocacy work, advocating the issues that matter most to cities, and providing resources and connections for city leaders. I live or work within a special entity within the National League of Cities called the Institute for Youth Education and Families. This is a grant-funded institute established to support city leaders in their efforts to take action on behalf of children and families. And the institute has 5 program areas, and early childhood success, that prenatal to age 8 area, is one of our focuses. And so we know, we've heard today, early childhood is a time of hope and promise, right? A hope and promise that every child can reach who they were meant to be and their potential. Unfortunately, here and across the country, not all children are thriving, and they're not all becoming who they were meant to be. The challenge in cities is that the programs, policies, and services that we've put into place are not always connected. Sometimes they're developed independently and they don't always work together. So well-intended, they sometimes put up roadblocks instead of building those bridges. So we've been working with Grand Rapids and Kent County for over 20 years, just on early childhood alone, trying to create more bridges, how to bring people together and smooth out those transitions. Our early childhood portfolio, our mission is to improve city leaders' capacity to do just that, reach across their communities, align the programs, design policies, and ultimately build systems that are responsive for young children and families and supportive. We do this by providing technical assistance, peer learning networks across the country, and access to resources. Our projects are grounded in these 2 system building frameworks that you see up on the screen. The first, the Early Care and Education Alignment Framework, looks at what does it take to bring the multi-sector systems together to build a high-performing system of equitable early care and education. The second framework is the building blocks for success. We developed that with the Center for the Study of Social Policy, along with a number of cities, including Grand Rapids and Kent County. And it talks about the components that cities put into place to bring everything it does around children and families to build those early learning communities. So like I said, Grand Rapids, through our community's children, First Steps Kent County, and the public school systems have really informed both of these frameworks throughout our long history together and over the course as we've revised them. Currently we have 4 projects, 2 focusing on each one of these, and 1 looking at a deeper look at the workforce, and another one looking at cities and their agenda in those earlier years, 0 to age 3. So our partnership with Grand Rapids and Kent County has gone back years. The city itself has been a member of National League of Cities decades, over 50 years. And the work within the institution, we began working together when the institution started over 20 years ago. And we've worked across the early childhood continuum and beyond through the youth master planning, all the children and early childhood work, children in nature and the greening of the schoolyards, after school, the mayor's education policy network, and the youth engagement work. Just to name a few, I could stand up here and talk about all the work. And Mayor Bliss has been a strong partner with us, along with her office and the county. And we're very grateful for all of that. Grand Rapids, what we're seeing across the country is there's these cities that are really, there's about 10 or 12 cities that are taking the lead and really moving early childhood forward. And you all are part of that. Not only were you the first to do fluoride in the water and get it in the water stream, but you all are on the leading edge of moving this world forward and really helping to keep that hope and promise alive for every one of our children. And so that's, and going with today's theme, you're informing each other with the gifts and the talents that you have across the community and all the assets. And you're informing not just locally, but within the networks that we have with the 14-city cohort that you're in with right now, but at the state level and the federal level, lifting up the needs of families and children and what it takes for cities to build strong systems. You're informing through the assets and the assessments that you're doing. You're equipping children, families, providers, community members, and civic leaders with programs and services, the best practices that you're bringing in, but most importantly, that commitment to work together across sectors, across programs, sometimes even competing programs, but working together with that common vision that all children will succeed and reach their potential. And you're inspiring. You're inspiring each other with everything that's happening. Oh my goodness, it's amazing, right? You're inspiring each other. You're inspiring each other because of your commitment to do better. It's not good enough that some of our children are thriving, right? We can do better. All of our children need to thrive, and they are all our children. And you're inspiring to cities across the country of all the great things that are happening here, the sharing of the best practices, the sharing in our sessions of helping each other problem solve and look at barriers and build those bridges and address those roadblocks. So in our work across the cities, in order to build these high-performing systems, we know it takes a village, it takes strong systems, and it takes strong partnerships and sustainability. Today, we're going to hear from 2 communities in the panel, Kings County, Washington, and Los Angeles. They're making advances in early childhood outcomes with strong partnerships and intentional focus on sustainability of the work. It's not just a program coming in and a program coming out, but looking at sustainability, that long-term, and a system that supports young children and families. One of the ways they're doing this, they're financing their work, is through dedicated funding. But today we're going to hear highlights of the work that they're doing, some of the challenges they face, and the keys to their success that they've done. So thank you very much. It's so good to be here, and I'm very excited to hear the panel, so I appreciate. And here's our team, so thank you on behalf of all of them.
Thank you, Nancy. It's time for our panel. We can get started. One thing I wanted to mention, the Post-its on your tables You can write questions for the end of this segment if you care to have a question posed to one of our panelists. I'm really thrilled to introduce Marcy Miller from Best Starts for Kids, Seattle County Public Health. Marcy has a broad range of experience and knowledge in the areas of early learning, program implementation, and building effective systems and policies. She has worked for the last 23 years in both the public and human services sector in direct service, nonprofit leadership, state-level systems building, and strategic planning and policy work. Marcy currently serves as the strategic advisor to Help Me Grow, providing direction and project management for the prenatal to 5 investments within Best Starts for Kids in King County, Washington. Welcome, Marcy. All right.
Thank you.
We can get started with a few questions. Can you tell us a little bit about King County? It would be really important for us to have some type of comparison or really something to gauge against.
Yeah. First of all, thank you so much for having me here. It's an honor. Great to meet all of you. So King County is one of the largest populated counties within Washington State. We have over 170 languages spoken, 19 school districts. We're the size of Delaware, and we have very urban areas and very rural areas. So sometimes I drive 2 hours to a community, and it looks very different from where I live in the city of Seattle. And I would just say that one of the things is that we have in King County, we have incredible technology, companies and growth, but we also have huge disparities. And we are really thinking about huge disparities around race and place, depending on where you live.
Thanks, Marcy. Now we would really like to learn more about Best Starts and what led up to the decision to pursue dedicated local funding for early childhood.
Okay, so in King County, we had been previously doing a lot. I mean, there's great programming happening within King County, but a lot of our, from the county perspective, a lot of our funding had been more around crisis intervention. And we had been focusing on, if you're in trouble, we'll help you out. So there was a lot of thinking around the science of early in childhood or infant brain development. We got our King County executive to go visit the Institute for Brain Science and Learning while his partner was pregnant, which was pretty key in thinking about that. And then got him excited. He said, we need to be doing more of that. And through that, we really created a very simple vision, which was that we wanted to see all babies born healthy, kids thriving, and young people growing up successful to be happy, healthy, and successful adults. And so in order to do that, we worked really hard in community to get their perspective. And we were initially just talking about prevention. We should really move towards thinking about prevention and supporting some early intervention when things were going a little bit awry. But as we talked about it, we were like, we had to move even further down the line to promotion for all families, for all kids, for everybody. And another thing we really thought about is that we had to, not only could we increase funding in programming, but we also needed to be thinking about what would it look like to really change the system and policies in order to do that work well. So what we ended up doing is putting a levy together. We call it a levy, we call it millage. So our levy was a housing tax levy, 14 cents to $1,000 assessed, and it was $65 million a year, about $56 per family in approximately. And we ended up combining it with thinking about prenatal to age 24, after looking at the science and knowing that brains continue to develop till age 24, and which makes a lot of sense. So 50% of the money is going to early learning. We wanted to ensure that not only were we supporting kids that were on our kids that were already in the system, so age 5 to 24. We dedicated 5% of the funding to evaluation. And then we also, and thinking about Dr. Renee's talk today, we talked about communities and healthy communities. And so 10% of the money was going into supporting healthy communities.
Well, Marcy, we have a room full of stakeholders here today, and it would be so great to find out the process you went through to bring stakeholders together to bring the proposal forward to the voters.
So I think this is one of the most important things that we did is really, as we were creating this, we went out to the community initially, and we had 3 values where we had to be relational, we had to be in relationship with the community. We needed to think about equity at the heart and center of everything we were doing, and how could we really be transformative around thinking around that, and transparent. Oftentimes, it felt to many that the government sitting at the county wasn't very transparent in how they were funding, how we were communicating. So we went out there with those 3 values. And what we did is initially, before the levy passed, went out and asked the very 3 simple questions. What are you doing? Or what's working in your community? What's not working? And what do you want more of? So simple. And we did it in a way, we did 10 community cafes in a community cafe model. Tons of staff got together and supported documenting that. And then we had our epidemiology team really take that data. And we came up with what was put on the levy at a high level around early childhood education and our 5 to 24, and it passed. So it was pretty exciting. But then we had to write an implementation plan after that in our process. And so what we ended up doing was going back out as we were writing the plan, and literally every night we would come home. There was a mighty team of 3 doing this work. We would come back and say, wow, we need to change what we were doing. And we said, this is what we thought we heard you say, but what else do we need to be doing more of? And most of it we were pretty right on. But one of the things, for example, is that we thought a lot about the science, that we heard loud and clear, you need to be thinking about the science, and you need to be thinking about community. And those 2 things together. And so, for example, we decided we should have a multi-generational approach, a 2-gen approach. And we were pretty excited about that. That's what the science was telling us. Community was like, no. You need to have a multi-generational approach. There's grandmas involved in this, there's aunties, there's brothers and sisters. So really thinking, so people watched us as we did these 10 community meetings, and we made changes that people followed us at all 10 meetings, that I could see how you changed it along the way. So that was really important. And we still are continuing to go out to community in different ways as this is happening, and it's informed our work as we move forward.
Marcy, in King County, where are you investing the funding for early childhood?
So we, again, 50% of the funds are going into our early investments, or we call it prenatal to 5 strategies. And this was really, again, based on community feedback, where we had a cut in our public health funding, so we had 7% of the money going back to public health. The rest is all going to community. We are investing in home-based services, and our community told us not only do we want evidence-based informed, but we want to have community-driven models. So we're investing in what does the community want, and we're providing technical support or capacity building to really be able to document what that ends up looking like. We were told they need community and peer-to-peer support, or like play groups. We use a model called Kaleidoscope Play and Learn, and then other different programming to support moms and dads and families. We are investing in a goal of universal developmental screening and other screenings. We're not defining what that screening looks like. We're really looking to community to help us build that out. We are looking at building a system of infant mental health, and we know we don't have enough money to do that right now, but what we're initially doing is doing a landscape analysis to understand what we have, what other training is needed, and then we can make some smarter investments. We're looking at child care health consultation. We don't have a strong system in our state, so we're working on building out our own system here in King County, or in our King County. And then we also heard from community we needed to have some more innovation. So we have a fund dedicated to innovation and what else is working. And then last but not least, we are building out a system to help me grow, making sure that all of this work is hanging together and is building on the great work that's already happening within our community.
So,
And then just quickly, I wanted to mention, as we're building this out, we have evaluation has been so important to this. And so we went out into our community and ensured that we had alignment around evaluation and our outcomes. So it seems simple, but to get agreement in our community was challenging. We went into the state and tried to we have agreement with the state. And so you can see our outcomes here. A lot of this, and then we're also measuring secondary indicators depending on what program you're working with. And then performance measures using, if we're funding you have that accountability. So we're using principles of results-based accountability, which has been really helpful. But we know we can't do this by ourselves. We have to have the whole community in partnership to ensure that this is happening. And the one in orange, which is flourishing and resilient, I just want to say that was a huge win in our community. We were at a board meeting and someone said, we need to be measuring joy. How come we can't measure how happy and the joy that our kids are experiencing? We want happy kids. So we are now moving towards measuring fluent and resilient children. And we actually created a healthcare survey in order to capture that information because that information wasn't available to us.
you touched on this a bit, but how is King County meeting a commitment to equity and inclusion and moving the needle related to defined equity issues?
This is a commitment of all of King County in the place that I work, and we are on a huge journey. There's so much learning that we still have to do, but this statement here came from our Children and Youth Advisory Board, who created that equity is an ardent journey toward well-being as defined by the affected. And thinking about that, we really need to be changing who we're bringing to the table, how we're funding, how we're engaging with community. So that has been, we are working towards this. I think we still have a lot to do. But community shared with us that it's really hard to get funding from the county. So we are providing things like technical assistance for free. We have revamped how we do RFPs or how we get the money out to a community so it's simpler. Our evaluation, we really, really care about numbers and outcomes and outputs, but we also really care about the stories. We know that it cannot be, that we're going to community, it should be community-driven or community-owned data. And how does the community tell us the story behind the data that we're looking at? So those are some of the ways.
You mentioned Help Me Grow. How has Help Me Grow impacted the system of early childhood services in King County?
It's a great question. We are really, honestly, in the exploration phase and moving right into implementation around our Help Me Grow system. In the state of Washington, we have a robust an affiliate for our Help Me Grow. And in King County, what we're looking to do is to build upon the strengths of what's already happening in the community and then building a system that meets the needs of all kids and families, not just certain families. We are currently looking at the component of having a centralized access point, as Help Me Grow indicates, but we have 10 call lines where I live. So we're looking at really working with them to understand what's the work that they're doing, where is the lack of funding? We know there's some lack of funding, and then what could we do in order to tighten, to make decisions together on how that could work for us. But we're really trying to leverage on the systems and communities.
Okay, at this time, I am honored to introduce Leticia Casillas-Sanchez from First 5 LA. Leti is a seasoned senior program officer in the Family Supports Department and oversees the agency's portfolio on family engagement. She has more than 12 years' experience designing and leading innovative initiatives for children and families throughout Southern California. Letty, thank you so much for being here today. We're going to pause a moment because we have a little bit of a tech situation. Great. Thank you.
Hi, good afternoon, everyone. Thank you so much for having me here.
Letty, my first question for you is, it's been 20 years since voters approved Prop 10, creating the First 5 network in California. Please tell us about First 5 LA and the network, actually, the First 5 network, and some of the milestones your community has reached because of these funds.
Wow, so 20 years in the making. It has not been easy. So let me just give you a little bit of background. So the state of California actually passed 20 years ago a tobacco tax, and as a result, 58 of our counties actually received this funding for early childhood. Now, LA County is actually the largest county within California, and the funds are actually distributed in a way where they look at the previous year's birth rates, and that's how they draw down the funds into different counties. And so, of course, Los Angeles County is actually the largest county, so therefore we receive the largest pot of funds. And just to give you a little bit of context about LA County, if we can go. So this is about First 5 LA, so we're a leading early childhood advocate, and we're working collaboratively across LA County with different partners and systems. And again, we were created in 1998 to invest LA County's allocation of funds from Prop 10. So moving on. This is a map of how we distribute our funds within what we call our Best Start communities, and there's 14 communities where we put these funds into. And it's not just specific just to only these communities, but there are other aspects of work that we do also fund in collaboration with other systems. But just to give you a little bit of a snapshot, so LA County has 10 million people. And if we were to be a state, we would actually be the 7th largest state in the nation, the size of Michigan. And you know, that's pretty impressive, but that does mean that that's very hard, arduous work that cannot be done by one entity alone. And so essentially, we look at our Best Start maps, and we also think about the number of children that we have. We're looking at about 220,000 children who are birthed to age 5 and actually live below poverty level. So that's pretty significant. And again, it just speaks to the urgency and how much this is all needed. And then also just giving you another bit of a snapshot about our community. We have about 130,000 birth rates, live births in LA County, so that's also very significant. And 1 of 8 families are actually below the 300% federal poverty level. So that's pretty much it on what I can share on that right now.
So Letty, before I move on to our next question, I wanted to thank both of you for traveling so far and out of time zones and really just putting out such an effort to be here with us today. So thank you. One of the questions that's really important to us as we're making our own planning as a county, what are the target outcomes of First 5 LA?
So currently we have several strands of outcomes in focusing our work. And one of the strands, as I mentioned before, it's actually within our 14 Best Start communities, and it's actually our community outcome area. And essentially what we're looking at is transportation accessibility and also food insecurity. We're trying to ensure that families have access to healthy foods within their communities. And I don't know if we can go back to the Best Start map real quick. I just want to give an illustration. So if you look at the map, you look at the very far corner, it's probably the 2 farthest, I would say from my end, it would be like the left upper hand corner. That is the Antelope Valley. And some people have to travel from all the way up there to our city area, which would be considered LA. And sometimes it takes an entire day drive for families to go back and forth. So we're trying to work with our transportation systems to alleviate some of those challenges. It could be very challenging to have maybe a 4-year-old who needs developmental screening and attention to go that far to get that specialized support. So that's just an example of that. Secondly, our other outcome area is our early care and education outcome area. And here we are looking to improve the quality rating improvement system. So we're trying to ensure that the early childhood systems are actually equipped and ready to provide services to the families and the children, but that is of quality. And also looking at professional development of early childhood educators. And then for our families outcome area, this is actually the largest investment that we have, particularly within home visiting. We have a homegrown model called Welcome Baby. And this has probably been one of the biggest successes that we have had for home visiting, because we did create an entire home visiting system throughout our county. And our Board of Supervisors actually made a motion in 2016 for our Department of Public Health, for our Home Visiting Consortium for First 5 LA, to come up with a plan to say, can we have home visiting for all families? So that's a pretty heavy lift. Needless to say, everybody's been playing very well. And we have a huge workforce as a result of that. So that is actually more of a push to continue the work. And then finally, also, our health systems outcome area, which is actually pretty impressive because we're right with the state of Washington around the work that's being done with Help Me Grow. So we're trying to develop our system as well, and also trying to work with other county systems to ensure that they're embedding trauma-informed care approaches in their work.
Another question that is really important to us, and you mentioned that you have dedicated funds from the tobacco tax from Prop 10. What impact have these funds made on your community?
The impacts have been very significant. Our 14 Best Start communities are probably one of the examples that are most astounding, because we have brought in our families to be at the core of our work. We've brought in the community to really speak on what issues were of priority to them. And they have actually been part of leadership as well, because they have been able to gain a lot of skills and a lot of opportunities where they can actually go out and advocate in terms of what they're looking for and what kinds of agendas they're interested in supporting. And then again, going back to our home visiting county-wide efforts, that has probably been one of the most recent successes of the work that we have been doing. And I tell you, it's not easy because we're under the radar, because we're being looked at very closely in terms of this system that really has been developed. I don't think that was probably the larger intent. It kind of grew into it, but it's definitely been exciting, but also intense.
We're probably going to have more questions about this from the audience, but what is the current landscape of parent engagement in LA County?
Oh, so parent engagement is actually, I think, a field of practice that has been around for a very long time, but I believe is starting to gain traction and momentum in terms of being called out family engagement. It's happening in different spaces. It's happening in different methodologies, carried out with families, all of these practices. However, we as a county have identified that we may be working in silos, so it could be called different things. And we are working with a group called the LA Partnership for Early Childhood Investment, and we have our largest unified school district at the table. We have other philanthropy partners, and we're looking at coming up with a common definition around family engagement, so that way we can be uniform in terms of what we mean. And it's actually very exciting because families should be at the core of our work, and they ought to be informing all levels of engagement, whether it's very basic in terms of an exchange, helping to inform programming, quality improvement, to advocacy contributions as well.
Now, we have one question for both Marcy and Letty, and I'll start with Marcy. If you could guide a community starting to pursue dedicated funding for early childhood, what advice would you give them?
Wow, that's a good question. I have two thoughts. My first thought is I would really build on the momentum that you have, that I feel in this room when I walked in, and turn to one another, because you're building this now, and it gets really hard. You've done such incredible work, and this is phase 1, and then you'll have phase 2 and phase 3 and phase 4. So using a trauma-informed approach for your systems building and how you work with one another, and giving each other the grace, because partnerships are hard. Maybe they're not hard here, but they are incredibly hard. And I think that that's the one thing, is trying, as we are working with our partners, giving each other grace, to think about how we can support one another. And the other, we always say, my team says, I am the prize, because it feels like we get to a place and then it might feel like we're not moving in the right direction, and then we have to get up again and move forward. So I think that's really important. And I think the other thing that I think you have done a lot of, sorry.
Small pause.
Okay, does that work? Okay.
Yep.
The other piece that I would say is building on or leveraging opportunities. In King County, we've had incredible work that's taken place. We have someone asked me about it today, called the Roadmap region, which is a specific region that has done incredible work in King County. I have the city of Seattle that has a dedicated levy for sugar beverage tax funds. And a lot of people will say, oh, well, Best Starts can take care of all of that, so I don't need to fund early learning anymore. And we're like, no, we are working together. We have a common vision that I showed you before, and how can we continue we need you to continue to do your work, and we'll build upon our work. And that's a hard message, and I think that that's just something I would really consider and think about as you move forward, is how can you build upon that momentum. And we have something called the Aligned Funders Group, which we have several big funders in King County specifically, and we're trying to get them together to talk to one another about how can I not fund what you're funding. So I think that's really the other piece I'd really consider and think about, and how would that work?
Thank you. Now, Letty, what advice would you give a community getting ready to pursue dedicated funding?
So first of all, you all are champions to begin with. Yeah. This is fabulous. And I would also say that because you are looking to obtain and pursue dedicated funding, that does not mean that you go out and you do this work alone. And that is where you become ambassadors of the work that you're trying to do, because essentially, just like Nancy said, it takes a village. Yeah. And you are part of a village. And for anyone in a system to see themselves separate from anything that you could be doing is not realistic. It really does have to be something that comes truly from the heart. And we all have to remember that it's up to us to raise these children, because they're going to be our future adults. And this was actually something that was a hard lesson for us as First 5 LA, because we were seen as the early childhood leaders, and you take care of early childhood challenges and issues, and we at the Department of Mental Health or Public Health will take care of health and mental health. However, that was not working, and so we had to come back to our partners and say, there's a lot of point of intersections, there's a lot of opportunities for us to work together. While you may be in mental health, we're looking at trauma-informed care. That is definitely connected to the work that our mental health department is doing, but how does that relate also to our Department of Public Health? So there were plenty of opportunities to start having these conversations to really see that there were opportunities to partner and collaborate, and that we could bring in funds from other resources, from other systems to support the work that we are doing currently. And for us, because we've been doing this learning for about 2.5 years, it's really proven to be very fruitful in the work that we're doing, and also very promising as well. So I really want the group to take this in and consider it, and start with that as your baseline as well. Bring that to the table so that no one thinks that you're only about the early childhood system, but that you need those partners in order to get ahead.
Thank you. So at this time, we're hoping to get some questions from the audience, and I'm going to ask my Metro blue shirted colleagues out there to move about the room and collect some of those questions. We're delighted to have Leticia and Marcy here to be able to answer some of our questions, and we're just so excited to be able to bring some of these to the forefront. We have time, so yeah, please write down your questions. And okay. So the first question, and I think this is for Marcy, they want to hear a little bit more about the peer-parent supports. What is this, and tell us more about it.
So that's a great question. Our peer-to-peer support funding stream is approximately $1.5 million, and it's a mixture of we're actually going to the community and having the community tell us, you define the community that you want to be working with, because in King County it's very diverse, and telling us what would it take in order to provide supports for you as a family. And that could be classes, it could be peer groups, it could be, we have something called Promoting First Relationships, which you may have heard of, a model. And so we're really providing a menu of services that it really meets the needs of the community. And along with that, we're also providing some technical support, because we really didn't find a lot of programs that were working within King County with some of our more diverse communities. And so we really are asking communities to be community-led, and then we're going to help document that work so we can evaluate it.
Thank you. The next one, I believe, is for Leti. What is, this one, I think you may be in the beginning stages of. What is the plan after the tobacco tax recedes?
Okay, so actually we're right in the middle of this, so this is actually a really timely question. So yes, as part of the decline in tobacco tax revenues, we've actually had to take a hard look at the availability of funds that are coming in. So great, people are not smoking as much in California. However, at the same time, that also has an impact on our revenues, because they are declining throughout the entire state. And this is part of the reason why we've looked beyond what we're getting in our allocation to create these partnerships with other systems, because we know that there's opportunity to partner. And we want to come in also acknowledging that they have their own agenda, but there's an opportunity to help support their agenda, just like we can get our agenda supported as well. One of the things that we have seen as well is that, looking at other philanthropic organizations who may be invested in certain aspects of our work, that's something that we had not explored very widely before, where now we're more open to going along those lines. And interestingly enough, I was at the Liberty Hill Foundation, a recognition award ceremony, and one of our program officers said, wouldn't it be interesting if we had to go out and recruit funds this way? And I looked at him and I said, well, we already are. If we're going to our Department of Mental Health and Public Health and asking them to invest in something that we find common, we're already doing that to a certain degree, even though we're not necessarily directly asking for funds. So it's one of those things where we keep that in mind. We are also looking at the marijuana tax as a possibility to tap into some funds. However, that's a very long-winded and highly politicized conversation as well. So more to come on that.
Thank you. Some really great questions, audience. Thank you. This one, I believe, is for Marcy. When you presented your levy proposal to the voting community, did you specify how the money would be used?
We did. To the voting community, we did at a very high level. We presented it in strategies. So I have them in my head as strategy 1B. But we really bucketed them in home-based services because that's what the community said. We talked about peer-to-peer supports, and we talked about childcare health consultation really at a high level. And then with that, it passed that way. Our voters, we felt that if we had too much detail, it would be scrutinized, and people could say, oh, well, we're going to take this little piece of it, or we're going to take this little piece. And then we went back and wrote an implementation plan, which is 168 pages of joy that anyone's welcome to read, that outlines in more detail. Yet it doesn't have enough specificity. And then the next layer down was really thinking about those RFPs that we're writing and the next phase of that work. But we did it at a very high level, and that was strategic in our community because we felt that would be more easily passed that way.
Marcy, this is a bit of a follow-up question.
Yeah.
Who administers the levy? Does the county administer it?
Yeah, that's a great question. I probably didn't make that clear, but King County, when I say King County, it is actually the Department of Community and Health Services, which is all, and then the Public Health Department. And when I got to the King County, we are one King County, but sometimes we don't talk. And we have been 50% of the funds go to public health, and 50% of the funds are in what we call DCHS. And we have the three of us, the three leaders, one leader was in public health, one was in DCHS, and I was in the middle. And so we really got people pulled together, and that actually was pretty transformational. It sounds silly, but that was transformational. So it really comes from King County, which is made up of both those entities.
Okay, there's a lot of questions for King County. Sorry, Leti.
Okay.
Was the county government the instigator of this initiative, or private advocates or nonprofits for King County?
It was, I would say, all. The King County executive, who runs both public health and DCHS, was the major instigator. I think he really feels this would be his legacy. However, there was support everywhere. I would say like a similar feel to what I feel here. Like everyone knew about it, talked about it. We had town halls. We didn't do there was a similar momentum and feeling here, but it was led by the executive.
Another follow-up, Marcy. What percentage of the population voted for the early childhood levy?
It was 60-40, so.
Great. One question that came in, I just wanted to make a bit of an announcement. Will the PowerPoints be available? And yes, we will make them available. We will probably reach out to everyone and send out where you can either access them, or we'll try to send them out to attendees, because I believe we have all your information now. There's a question about the home-based services, I believe, for Leti. You mentioned that in your presentation. So they want to know about, and I might not be reading this correctly, CHWs?
Community health workers.
Yep, there you go. Okay. And what advocacy around reimbursement for their services have been done? Yep.
Yeah, so around that, that's one of the things that we're actually doing some research on, and that is actually one of the sustainability strategies that is being utilized currently to see what kind of reimbursement can come from medical health plans in our area, and also from what we would call Medicaid, Medi-Cal funding. So it's very much in the exploratory phases. They're looking to see what items or activities are taking place within the model itself that can be reimbursable. And then in addition to that, we are doing work within the clinic setting as well, which also calls to the care coordination piece that clinics contribute to. So we're trying to also see if there's any opportunity to also obtain sustainability funds through that work as well. So it's very much in the exploratory phase, and we are going to be launching a pilot of the work as well to see how much reimbursement can be obtained through the work that's being done.
We are actually doing the same thing, exploring that as well.
Good to hear. So Leti, how did you begin to build partnership with other agencies to avoid duplication of services?
So I think the best example that we can provide is around home visiting. So we have the LA County Perinatal Early Childhood Home Visiting Consortium, which is a mouthful. And so essentially what we did is we rallied all of the home visiting models that exist throughout LA County, and we wanted to see where there either is duplication or similarities, and where there are differences. And then also looking at a matrix of referral pathways as well. So if one cannot achieve one thing and you find a group of parents who have a different need, how can they use a matrix to go ahead and refer families throughout the system? And interestingly enough, as a result, we've identified, I want to say like maybe 5 or 6 different models that exist throughout LA County. And so essentially what we're trying to do is we're trying to strategize in terms of the work that's being done so that we can partner, collaborate, and come up with some level of common measures, because there are things that are being measured very similarly that we want to know about, like maybe breastfeeding rates, number of women who are accessing their prenatal care on a timely basis, immunization, well-child visits, and that kind of thing.
Thank you. Marcy, I think I have a final question. I'm not sure. There may be some others coming up, but that's fine. Any innovations or anecdotes coming out of Prenatal to 5 Innovation Fund that you mentioned? Anything that you can tell us about that?
That's a good question. I would say one innovation that I can speak to is our community-driven home-based services model, and that we just awarded our RFPs just now. So I would say that we're really in that infancy stage around that. And our innovation fund, we are waiting until all of our money goes out the door and have our innovation fund go last. So we haven't done that work, but we're partnering with Frontiers of Innovation, or the Harvard Center for Children, because we wanted to have an approach using their ideas framework so people can document the work and make sure that it's written down. And we're also pushing Harvard to really be thinking about their equity approach, and so partnering with local folks and embed that capacity locally to do that work. So we don't have any very specific innovations yet, but we're working on our approach to getting those dollars out the door. So I think in 2 years from now, we'll have lots of good, it'll be interesting to see who's awarded.
And we'll ask you back.
Yeah.
So Leti, I believe this last question is for you. there's some clues in it. What structures or governance and otherwise are in place to help manage systems that serve 10 million, 130,000 births?
Wow, so there's a lot of governance structure. However, I'm going to be completely transparent. It's not always the greatest because we want to be very collaborative and partnership driven, but sometimes by nature we fall back into our old habits and we become siloed. So as part of some of the work that has been done throughout LA County, there was a partnership brain trust that was actually brought together, which has some governance structure that brings together leaders from multiple systems where they have conversations about the common work that we have together, and they actually are decision makers at the table. And then they go back to their respective systems and they actually inform their systems of the work, and then they incorporate that work back into their work with other partners. So there's a lot of momentum and there's a lot of conversation, and needless to say, we've had conversations with our probation department for men and juveniles, and you might say, well, why is early childhood even in this space? But young men and men who are incarcerated have children, and they may be under the age of 5. So that may be, and we talk about equity and inclusion, so we want to make sure that we are equitable, that we are inclusive. So that means that we have to turn over every rock, basically, and see what's there.
Well, thank you. This has been very informative. I hope you join me right now in thanking our panel speakers. Thank you. At this point, I'd like to bring Lou Chamberlain up from our board of directors for First Steps, and he is going to close out the day for us. You can just stay.
I get to be the closer. I represent the gray tier of a multi-generational approach. Well, we've come to the end of our day together, and I hope you all have found this as interesting and inspiring as I have. And I hope that we all walk away from this conference today with a little better understanding of why early childhood is so important in our community. I have some people I want to thank. Starting with the folks who've come from afar. Nancy Lim from Washington, thank you, and thank you for the kind things that you had to say about our community. To Marcy and Leticia, thank you very much, especially for sharing sort of the roadmap to sustainable funding that you shared with us, which hopefully we will be able to use and put into place as we move towards sustainability ourselves. I want to thank Dr. Boynton-Jarrett for her insights on context and structures and those glass separations that we don't always see, and for reminding us about how brain chemistry, or the architecture of the brain makes the first 5 years so important. And certainly I want to thank her for reminding us to keep putting the fluoride of early childhood into the water here in Grand Rapids. I want to thank all of our breakout presenters. We had many. We covered 1 million different topics. I was able to be in a few. They did a great job, and I'm sure they all did a great job. I want to thank our sponsors and our steering committee. I'm not going to name them all, but if you pull out your program, there they are. Without these folks, we wouldn't be here today, let's face it. So I want to thank them. Most of all, I want to thank all of you for being here, especially elected officials and prospective elected officials that are here, for taking the time to come and join together with us. We really appreciate, this is a big block of time, a big commitment. We really appreciate all of you being here. I think today's conference has prepared us and hopefully inspired us to move forward with the work that we need to do in building a system of early childhood support here in Kent County. There's a lot of work that needs to be done. We know that there are a lot of challenges, and one of those challenges we've been discussing, and that's sustainability. But I think it's a challenge we can meet. I think it's a challenge that everybody has a role to play, kind of as we discussed a few minutes ago. Certainly there's a role for the legislature, which they have been playing and hopefully will continue to play. There's a role for philanthropy. There's a role for local government. There's a role for philanthropy. Did I say that already? But there's also a role for the community at large. There's a role for our citizens here in Kent County. And to that end, I think you're all familiar with the fact that we are proposing a millage to support early childhood. It's being considered by the county, whether they'll let that go to the voters, but certainly we want you to be aware of it. On your table, there's a Q&A that explains it. There's also a call to action here. If we're gonna get this thing over the finish line, it's gonna take a lot of help. So please take this, drop them off at the advocacy table or leave them on your tables here and we'll pick them up because we're gonna need all the help we can get. As we gather that money, I think it's important to remember that every dollar we raise for this early childhood system will come back to us many times over. It will be repaid to us. Anybody who knows me knows that I'm going to talk about the return on investment. There is a return on investment here. Savings in expenditures that are currently made down the line that we won't have to make if we intervene with our children when they're young. Savings that come from having happy and healthy and successful children who become participating members of our community. So, as I've often said, and will probably say more often, this is not only the right thing to do for our kids, to make sure that they begin life and continue life healthy and happy and successful, but it's the right thing to do for our community. It will save us money in the long run, and having these children turn into successful members of the community will float all of our boats. It's an economic development issue. It's a workforce development issue. This is probably the most important issue that's in front of this community right now. So, thank you all for being here. Make sure to fill out your evaluations. Please fill out these cards right here. And thank you for your time. We are adjourned.